I remember talking to him, and I said, wow, I feel like I'm getting a cold. So I started off with a cold, went to a fever, went to pneumonia, went to double pneumonia, and then that's when I found out I had COVID.
I called the ambulance to come because I couldn't breathe, and they take me to the hospital over there, and they gave me antibiotics, whatever, but the next day it got worse.
I was in the hospital for about a little bit close to 3 weeks, and where they put my room at, he's literally right under me, and I couldn't go down and see him. I couldn't see how he was doing. When I left, he was still in a coma.
The experience I had, first it was the thing of giving up, life, you think that's it. This thing really, it's a mental thing, and I just didn't want to do anything. I want to just lay there. You want to give up. And then with the nurses and talking to them, it gave me hope. And the door opened, and it's just so, you just see 2 rows of nurses, and cheering me on. I'm like, oh man, this is awesome. I never got this type of attention before ever in my life. I'm like, oh man, it's like you're going down, it's like walking out of a football stadium, the tunnel. Everybody's cheering, yay! You're like, oh man, that was a highlight,
And some of the nurses were tearing up.
Yeah.
They were tearing up. And it was just like, they were just so genuinely happy, and it was a good feeling. I didn't think I was gonna see him again. And then to see him, I was just relieved. It was just like big, just pressure just lifted.
Yeah, I looking at it, it's just made me be thankful for life. Not that I take it ever for granted, but looking at that and knowing what I went through, where I couldn't hardly talk, winded, could barely walk, even when you want to give up or you felt there's no one to talk to, because like I said, with COVID, nobody can come visit you. But by them coming, you begin to get a little more personal. Hey, how's your husband? Or hey, how's your family? A little bit more personal. It helped the journey of getting in the recovery, of getting out. Yeah.
And you can just tell they love their job, they love what they do, and to be around that and have a positive outcome from this experience means a lot.
I am Dr. Augusto Sigliano, and I work each day as an emergency room doctor at Emanate Health. I see firsthand the impact this virus has on the health of people such as William Cummings and Dr. Ebony Kemp. I have also witnessed the remarkable strength of our healthcare workers caring deeply for people in need of compassionate care. Our hearts go out to everyone who has been impacted by the virus, either directly or indirectly. Fortunately, we can offer hope to these patients, and many have survived because of the hard work and efforts of our doctors, nurses, and all of our Emanate Health staff working together. You can join our team and make a difference by donating to the COVID-19 Relief Fund. We created this fund to support all of our services we provide at Emanate Health. We assure you that 100% of your donation goes towards our efforts to keep our community safe during this crucial time. Please join us in our efforts to battle this virus and donate to the COVID-19 Relief Fund.